Grant.
Now let's move to the coronavirus. Today, Beaumont Health is out with a new warning as COVID cases are steadily on the increase.
An expert there says this could be a disaster for Michigan as they push for all of us to take steps to stop it. Paula Tutman is live at Beaumont Hospital in Troy. And Paula, two major things here: mask wearing and vaccinations.
Absolutely. And listen, this doctor is basically saying you shouldn't need a mandate or rules to wear this. This is a very thin line between us and that virus, which is really gaining steam, and then a very thin needle, a shot. And he says time is running out for the unvaccinated to get vaccinated before this gets out of hand, and they don't have anything to battle it back for any of us. Possible disaster on the horizon. Those are the words of a Beaumont doctor who says he sees a deeply concerning uptick in COVID hospitalizations.
I think the potential exists for a huge disaster, and what do you want to call it? Surge 4, Surge 5? I mean, I've sort of lost count.
Dr. Joel Fishbane is the medical director for infectious prevention at Beaumont Grosse Pointe. He says currently in the Beaumont group, there are 64 patients hospitalized with COVID. 61 of them are uninoculated, which means they have not gotten any vaccinations against the virus. Another 3 have gotten the vaccine and the virus broke through.
Only 0.06% of our COVID cases are considered vaccine failures. So vaccination is still very, very good.
He talks about the Delta variant, and what he's seeing in terms of new cases is as concerning, if not more concerning, than what we experienced last year. When you factor in vaccine resistance, COVID fatigue, and the politicalization of mask wearing, and children heading back into the classroom.
Especially if you look at under 12-year-olds who are not eligible for the vaccine, the kids can bring it home. And then obviously, if you've got family members not vaccinated or family members who are vaccine failures, but you just don't know that, there could be a marked increase in cases. And don't forget the high risk categories of obesity, diabetes, age, et cetera. So the potential exists.
Yeah, you know, and I also asked the doctor if there was any medical reason people should not or can say that they cannot get this vaccine. And he said, other than an allergic reaction to something inside the processing of that vaccine, because remember, this is not live virus. So anything other than what's inside there. So not pregnancy, not fertility issues, not pre-existing not pre-existing conditions. Sorry about that. Easy for me to say. But he said none of those things should keep people from getting this vaccine, and the window is closing in order to get a hold of this Delta variant, which is very, very virulent, guys.
Okay, Paula, thank you. And now